Welcome to the Heart of It, where we take you to the heart of healthcare. This season, we're exploring what happens behind the scenes at Fraser Health to ensure patients receive the best care possible. Fraser Health provides care on the traditional, ancestral, and unceded lands of the Coast Salish and Inklakatma nations and is home to 32 First Nations within the Fraser Salish region. Fraser Health is dedicated to serving all Indigenous people and honors the unique cultures of the First Nations, Métis, and Inuit living within the Fraser Salish region.
Really excited to talk about our digital transformation journey today. And joining me today is Jennifer MacGregor, our VP of Digital Experience, as well as Dr. Hassanali, who is our Chief Medical Information Officer. And together we'll talk about what it looks like today in terms of access to care and what it looks like tomorrow through our digital transformation and some of the things that we worry about and some of the things that we are very excited about. So maybe I'll start with Dr. Hassanali and ask about what does current kind of mode of access look like into our health system. I think one of the things that we hear a lot about is that people feel quite frustrated about lack of access to care and supports.
Yeah, thanks first of all, Victoria, for having me on today. It's a good question in terms of access because you're right, there is a lot of frustration from our public in terms of how they get access into our system. We know that a lot of people face medical crises and end up having to come through our bricks and mortar locations in terms of the emergency department. And I think what they try to do sometimes is they try to navigate, they may call their family doctor's office and, the hours of business sometimes are conducive to when your illness strikes. So, later in the evening or potentially on a weekend, you call that GP's office and it's a voicemail that says, unfortunately, we're closed. And, maybe if this is a medical emergency, try to go to a local walk-in clinic or potentially the emergency department. But obviously, when you're there sitting with maybe a sick loved one or sick yourself, and you feel that you do need urgent medical attention, you do feel that you are sick enough to maybe warrant a visit to the emergency department. So that's what I often see. I work in the acute care side of the system. I end up admitting some of those patients that do walk through those doors that are sick, but I know for the vast majority of those encounters, they are able to be discharged back out into the community. But it does put a significant burden on our resources when we have a large number of our patients' encounters showing up through the doors of our emergency department.
So, Jennifer, how would our digital front door change that access point?
So our goal is, instead of taking the opportunity to go on to Dr. Google, you can come to our Fraser, which is our digital care navigator, and you can ask Fraser some key questions. And what we're learning from our new digital front door is a lot of people want to know how to access some of our outpatient services, where do they go for stress tests, for other types of appointments in clinics. So it's not necessarily those urgent or emergent, but they want to know how to navigate our system. And so they come to the digital front door and they'll have an interaction with our avatar.
Yes. It's a cute little avatar,
It is. It is a very cute little avatar. And Fraser will direct you to the most appropriate service or where to go, or can connect you and tell you to call our virtual care line to talk to one of our nurses.
What are the capabilities of Fraser today, and what do you see immediately as next steps?
Right now, that digital experience does start on our external facing website. So www.fraserhealth.ca is where you go to interact with Fraser, our navigator. And as a patient, you will have a series of prompts or questions that you're asked. And like I said earlier, the first question is always, is this a medical emergency? In which case, Fraser will point you to seek urgent care, whether it's through the physical emergency department that you can get to or calling 911. We never want to replace that or make patients think that they're going to expect urgent, immediate, life-saving care through a chat experience or a virtual experience. But the ability for Fraser to kind of navigate for you the services that you need, I think is quite astonishing. I actually have been playing around with Fraser a little bit since it was released and actually testing it a little bit. And it does point you to a human in a few cases. If you do need to book yourself into an urgent or primary care center appointment, it can help facilitate that. It'll ask you your local postal code and put you to the closest UPCC, which is great. And you can potentially book an appointment there. It also helps connect you to a virtual health nurse line if required. So maybe your symptoms require a bit more triaging expertise. In that case, like Jennifer, you said, the human does get part of the loop there, and we do put you in touch with the nurse through a 1-800 number. And the hours of service, I think, are quite extensive today, which is great because like I pointed out at the beginning, oftentimes we feel that we're stuck to have to go to Emerge because it's the only source open. Whereas we know that Fraser is open longer than your family doctor's office and can help facilitate kind of your encounter through the next step of your journey.
It's a scripted process today. It does ask you a series of questions around how you're feeling, how we can help you, depending on your answer. If you say if you've had a stomach ache, for how long have you had a stomach ache? And the immediate default is to have you call in. So it'll immediately direct you to call our virtual care line so you can speak to one of our human nurses. But it has a series of notes. One of the key services that it does ask you a lot about, and you can find out more about, is our mental health and substance use. That's a very common workflow that it walks you through about how you're feeling and what your particular needs are.
Yeah, it's a big area of need for navigation of services for sure. And that's what it's currently able to do. But I believe because of AI and everything else, it's growing and evolving. So are you able to, Amyeen, share a little bit about what's like, we heard about what it's able to do today. What about tomorrow?
Yeah, no, it's a great opportunity. I think it's an exciting time to be a healthcare provider in the health space because we are leveraging technologies that have been in use for, I'd say, at least a few years now in other jurisdictions in terms of sectors. Like you think of transportation, you think of banking. You know, if you need immediate support in the moment in any of those areas, you have the ability to click on a chatbot. And in fact, we are very happy to, excited as providers because with our new digital transformation and our advanced clinical information system, Meditech Expanse, we actually have a chatbot now supporting our providers and clinicians in getting support. But getting it back to our stakeholders in the community and our patients and our populations that we serve, I think what our goal with Fraser is to almost anticipate what the expected outcome might be for an encounter. And so these systems are getting smart enough to recognize certain patterns of behavior. Is this an emergency or not? I think actually one of the first questions Fraser asks you today is this an emergency? And if that's the case, stop here, end up either calling 911 if you can't get yourself to an emergency department or take yourself into an emergency department. So we don't want to take away that ability to get urgent access or urgent help in the moment if you actually need it. But where we're heading with Fraser is the ability to actually put behind the system a whole spectrum of applications and services and build out those models so that right now we do have virtual nursing care, we have virtual dietitian services, we have some remote patient monitoring services as well through virtual, but we want to expand the service offerings that are available. And AI will start to prompt you for questions similar to what you get on different chatbots today. Are you looking for some help with mental health? Are you looking for more care in terms of home health services? Are you needing equipment? How do we as a health authority on the acute care side of the house maybe offer more support to that so that patients aren't always coming into acute care? They're leveraging that relationship with their primary care provider. So we're trying to connect these systems and these, sometimes what we call them as silos because the information sits in one system. We're trying to connect those systems a little bit so that we actually know the patient as well as their primary care provider does. We're able to anticipate what their needs might be. If they do have a chronic disease, COPD or congestive heart failure, they'll be able to get resources, and actually we can prevent potentially a patient encounter because we know they're due for an echocardiogram or potentially a spirometry assessment. That's where our goal is for getting Fraser, our digital assistant or digital AI tool, navigator we'll call them, into the general population in terms of utilization.
So say I'm, a daughter of an 87-year-old father, used to be really healthy, independent, lost the spouse, and now struggling at home for day-to-day activities, food preparation sometimes, and has some renal health or other health needs that are chronic, and it's not, fully being met through a general practitioner or family doctor in the community. Like, Well, how would this actually help you? Because I think sometimes we have all these words that we use in the health system, from home support to long-term care, all these words that are really foreign for the rest of the population. So how would Fraser help this daughter?
So, one of the goals is to ensure that Fraser starts to know who you are and what your needs are. And so, if it's around food security, diet, nutrition, Fraser's knowledgeable about this, and Fraser can have a conversation with you about what is a healthy meal for somebody who has a specific chronic condition and give you that guidance right there that doesn't require you to maybe call or follow up with a clinician. So it's how can we bring information to you? What we're finding is that a high percentage of those interactions today are people seeking information. They don't necessarily need to see a clinician. They're seeking information. So how can we bring that information to you, and then you can ask more and we can give you more. And then the next time you reach out, Fraser remembers you and they can ask you how your dad is doing. How is it going? Have you tried the new diet? And what more can we do for you today? It's that sort of relationship.
Based kind of concierge, relationship-based concierge service to support our patients and families in the community.
And that's future. And even so much as if you're a new mom, there's an opportunity, you can order some groceries. We'll link you to where you can get some groceries, link you to where you can get an Uber to your next appointment once you schedule
Sounds
an
very
appointment.
convenient.
Yes, that's the vision of how these concierge digital navigators will help you.
And I'll extend that one point further, Victoria. I work as a hospitalist in some of our acute care sites, and a common presentation for the patients that I see is actually similar to what you described. A recent widow or potentially a loss, and now living at potentially some risk, whether that means needing home support services or dietitian services and food and nutrition equipment. These are common presentations that we see in our acute care system, and they lead to potentially unnecessary admissions that I think are avoidable in a lot of sense. With the use of a tool like Fraser, this thing gives families and loved ones the ability to say, hey, we anticipate that our loved one might need a service that potentially was being cared for by someone else, and how do we support that?
I'm sure some of the listeners are thinking a little bit about how is my data going to be protected if Fraser starts to get to know me personally? Is there any privacy concerns, or is there other concerns? How are we protecting that? So maybe I'll start with Jennifer on that one first.
So information that you provide is locked behind our firewalls and not accessible. So there isn't to worry about that. We do follow very strict rules, regulations, and laws around the use of personal health information.
And what about, Amyeen, one of the other things that in our population that's very diverse that we worry a little bit about is, and seniors in terms of digital literacy, but also diverse population and diverse needs, different languages, as well as whether people have access to devices from different income groups. So how do we manage those types of things as we bring these new technologies on board to better serve our population?
Yeah, that's a great point, Victoria. And I think there's a vast, array of different, we'll call it digital literacy amongst our population. Some people feel quite comfortable picking up their smartphone and joining a Zoom call, and I think the pandemic may have pushed some people in that direction. I know my own parents, they had never really used their smartphone for anything. And then they were asking me, well, where's your digital passport, your vaccination passport? And I'm like, oh my gosh, you know how to download that yourself. So I think we've seen a movement, and I think we'll continue to see that evolve. But you're right, we need to have low tech options. Don't get me wrong. There needs to be low barrier access. And so it could be as simple as a phone call, right? Most people can pick up a phone and call, and we still have that available to them. So whether or not they can use a virtual option with video capability, or maybe it's just a televisit through a traditional phone call or landline, that's still a possibility. The language barrier is interesting, because as our health authority is growing, we notice that there's more and more populations that don't necessarily speak English as their first language. And so we see that in the acute care side of the house all the time. I have patients that I visit with that I'm not able to communicate with. I think one of the great abilities of the technology is to have virtual translation services. And it used to be that I would look for the nurse or the care aide or someone on the staff that can speak the language of the patient I'm about to see, and pull them in with me and say, hey, can you help me have this conversation and find out exactly what's going on with this patient? Now I have the ability to actually use a virtual translating service. So I can pull in an iPad and has hundreds of different languages that can interact with that patient, so that would have a better relationship experience with that patient. Moving it to the digital side of the house with the virtual visit, we are hoping to leverage that technology as well, so that patients that are encountering us and using us for encounters virtually will have the ability to use translation services as well, so that we can communicate with the populations that we serve on a more meaningful basis.
I really wanted to dig in a little bit more, because I think one of the things that we really do need to pay attention to is how do we unburden the healthcare providers from doing non-clinical work or administrative work or burden. And I think what you're getting to with that Meditech and Google AI is that we're trying to free up that time. So can you tell me a little bit more about what does that look like?
Yeah, so it's an exciting partnership. We are the first site in North America to be utilizing this technology with Meditech Expanse. I think it would help for our listeners to understand a little bit about what my current workflow is. So I'm a hospitalist physician, which means I get to care for the patient that gets admitted for usually a length of stay on average of between 7 to 9 days. And my general age of the population that I care for is above the age of 75. So usually an elderly population. Coming with the most common presentations are usually exacerbations of COPD or heart failure, a bit of cellulitis maybe. And so when I'm caring for them, I have to write progress notes on paper. As you mentioned, we still use paper and pen, and I'm sitting there and writing my notes. And at the end of their journey with us in the acute side of the house, I need to summarize their stay. And I may not be the only provider involved in their care. I may have taken over their care from one of my colleagues. I may have had a consultant come on and provide some guidance in terms of diagnostics or interventions or therapeutics that should be utilized. And so in order for me to facilitate a safe handover back to their primary care provider in the community, I need to create a discharge summary. And so historically, without an advanced clinical system like Meditech Expanse and AI, I would have to mine through the chart. I'd have to go through each progress note and understand, okay, what happened to this patient? How did they present? What did we do? What were their lab results? What was their imaging results? And actually summarize that into a comprehensive document that could take me up to 45 minutes to an hour to actually go through that. And for some patients that have been in our system for, I hate to say, longer than 7 to 9 days, it does become quite an onerous task. And so what Meditech and Google have been able to provide us with is the ability to actually synthesize and summarize the stay through the use of AI. So no longer do I have to sit there and mine through charts and data and visits. I can actually rely on a solution. Now, I'm still part of the loop, and that's a big part of this. We want to keep the provider and the clinician part of this loop. We're not just relying on the technology to say, go summarize the stay and then spew out the result and send it downstream. We still require the provider to actually validate the information. And it helps to train the bot, so to speak. It helps lead to improved efficiencies and improved accuracy of the actual AI engine. And so we are in pilot phase right now with this vendor in terms of Meditech and Google. We have some very excited clinicians because it is a huge area of physician burnout to have to put together these discharge summaries and mine through the chart. It's a huge time saver for us to be able to utilize technology to do that. So we are I'd say in the infancy stages in terms of the pilot, but we're hoping to expand it to all our Expanse sites. And as more sites come live with Meditech Expanse, they will have this ability. And that can be taken not just to discharge summaries, but I think to other encounters as well. Handover is a good example. We have multiple providers involved in a patient's care, and it often requires us to communicate as care team members to say to a specialist, okay, specialist, can you take over this patient's care? But wait, let me tell you about everything that's happened so far. And oftentimes I have to write a document or dictate a document. AI can help support that as well. So I think there's a lot of use cases for this type of technology that summarizes the patient's stay so far and then provides a comprehensive summary to another provider so that they can take over and provide meaningful care to the patient.
I think you're talking about augmenting like workflows, and what I really appreciate about it is reducing burnout, because we need our providers to be healthy and well. And also, I really appreciate that it's releasing time for care, and that time that's taken with our patients and families. So what does it look like for patients and families if we actually do this well?
Yeah, that's a great point. We know that the use of technology to support that workflow will actually lead to length of stay improvements and actually get that patient out the door so that they're back functioning in society, out of the hospital walls, as they want to be back where they normally are in terms of out of acute care. So I think it will really benefit the patients that we serve.
That's a great point, Amyeen, and I'm sure, Jennifer, you'd like to add a few points there too.
Yes, the digital patient experience is a journey that we're very focused on as well. And it's important that we help with coordination and the flow of information, and also the flow of information to the patient, so they have access to their information and can understand where they are in their journey, why they're potentially waiting to be discharged and what's happening, to be able to ask questions, and then to make sure that they are not going to have to answer the same question over and over again, depending on which clinician or service they're accessing. Because again, we know you, and when they return to the community, that their primary care provider knows about their experience at a Fraser Health facility and organization. And again, they're not going to have to give a summary to their primary care physician. So a lot of this is around how we connect it together, how we ensure our patients are confident that we know all of the most important information about them, that we communicate that we don't have fragmentation or nothing gets left between the cracks, and that you can easily access the information when you need it.
So hopefully better satisfaction because we actually know you, we actually can spend more time caring for you. There's less time worrying about administrative burden for the providers, but also better experience because it would be much more connected through the information that's flowing between different parts of the health system overall.
Yeah, that's the vision.
One other thing that I think we may have skipped over a little bit is the enhanced clinical decision support for our teams. Right now, we ask our providers and our teams to rely on various amounts of sources of information to help with diagnostics. So I need to use my smartphone to figure out what therapeutic intervention, what dose of medication to give a patient. I need to rely on a paper system to fill out a form. I need to fax something to a different service provider. With Meditech Expanse and moving everything to a digital platform, we can actually build that workflow out fully electronic and actually provide real-time clinical decision support to our teams that will lead to better, safer patient outcomes. That's our quality mantra that we're trying to drive towards. We really do want to enable our providers to practice safely to lead to better care for our patients.
Yeah, I think that's an important piece as well. And I know that, that's one of the exciting areas that we want to transform quickly because it's foundational. But there's also other examples from virtual psychiatric units to virtual care and many others. I'm sure, Jennifer, if you want to highlight one or two of those with, I think, patient stories that's touched you.
Yes. There's been so many in the past year with both our Fraser Health virtual care line and patients who call in and seek advice. They have a sick loved one, and the service that they're receiving immediately is obviously when there are children involved. Those are the ones that I typically remember. We have had new moms call in with a series of questions about their newborn and seeking some guidance, whether it's a rash or maybe potentially a higher fever, and they get help right away, and then we call them back, and the feedback and the satisfaction has been very rewarding. And so those are the stories that I remember.
And what about we were the first in BC, one of the first in Canada to roll out our virtual psychiatric unit as well. And I think came from the pandemic will likely have this tsunami of mental health substance use concerns, and virtual is one way for us to extend our services. How has that gone? And any stories that you like to share, Amyeen?
I think it's an exciting success for us as an organization to be able to stand up a fully virtual unit in all intents and purposes of the word. It really is that end-to-end care of the patient, almost like they were in a bricks and mortar location, which is huge. So I'm excited about that. They've seen great success in terms of the numbers, and I know they're looking to expand in this coming year. I think what we're also looking at is providing other patient populations with the same type of virtual unit experience. And you think of other populations that have chronic conditions, congestive heart failure, COPD. Those are common patients that we present and admit to our hospitals that potentially could be cared for in an outpatient virtual environment. And so I'm excited about this as this is what we're starting to think about and plan for and actually have in our system to help support the care.
The VPU, the virtual psychiatry unit, has been a great success. We've tripled our capacity in the last year. We've had over 200 patients come through that service. very high satisfaction rates, much lower readmission rates into our inpatients. So we're not having to bring you in to the facility. And a lot of those patients, they don't want to be cared for in a facility. They want to stay at home. Yeah. So it has been a big success, and we're very proud of the team, and very happy to be a leader in this space here at Fraser Health.
And I think one of the things that people might be wondering about is what's different about this virtual hospital or virtual hospital units versus real bricks and mortar hospital units. And maybe, you can do a compare and contrast.
Yeah, so if you're a patient in a virtual unit, whether it's a psychiatry unit or future maybe a medicine unit, your care will look quite substantially different because you will be in your physical home, which is a huge benefit for, I think, patient in terms of sleeping in your own bed with that favorite pillow. We know that a lot of our length of stay impacts happen, and delirium actually happens in the hospital because of the new space that you're in. Your circadian rhythm is actually put off when you come into an acute care system when the lights are always on and maybe there's noises that you otherwise wouldn't anticipate that keep you up. So there's a lot of these potential adverse events that happen in hospital because you are physically in a new location that could be mitigated by being cared for in your own home. I think the other thing that's going to look very different is that we will be able to utilize remote nursing support staff to come in and care for you on a very limited amount of time. So for the majority of time, you're going about your day the way you normally would, but there will be some interactions with our care teams, whether it's care aides or nursing staff that come in, check those vitals, maybe administer medications, that sort of thing that could happen in a virtual environment. I think what we see is that the length of stay, if you looked at true length of stay in a bricks and mortar unit versus a virtual unit, the evidence would suggest that your length of stay actually is reduced when you're at home being cared for virtually. And it's just a matter of having oversight medically. So you still need a provider involved and a clinical team involved, but moving you through that journey of your disease progression actually happens a lot quicker when you're in your own home, which is an exciting thing.
Back to Jennifer, can you give us kind of a sense of different virtual, digital, AI kind of support and services? Because I know that it ranges quite a bit. We've got a significant activity in AI, even like with scopes to actual services that are mostly virtual to hybrid. So maybe if you can give kind of buckets of what it looks like and what are some of the examples of services?
So we think of it as a hybrid care model, a number of services. And so if you can think about it, I'll start with from a provider perspective or when you're in the facility. We do have virtual hospitalist services. And what that means is that the patient is physically with us, yet the physician is away. And so when you are at Eagle Ridge, for example, and you're admitted, there is a hospitalist service that is virtual. And these providers are reviewing charts, looking at everything within Expanse, making decisions, ordering, and if they need to see you, an iPad will come to your bedside and you'll engage in a virtual conversation with that provider, and then other decisions will be made. And so we call that virtual hospitalists, and that could be extended to virtual neurology. We have virtual psychiatry that way as well. We have one of our providers who rounds on their psychiatric patients using an iPad and having virtual conversations, even though the patient is physically located. So we sort of like the patient is physically located, yet the provider may not be, and so you're using a virtual modality for that.
I'm curious from your clinical experience, Amyeen, is there one patient story through our virtual transformation that you've been really touched by?
Yeah, I think, Jennifer, you mentioned the pediatric population. For me, in the patient population that I serve, it's more end-of-life care and geriatric population. And I think having the ability for someone that wanted to take their palliative care experience home and not have to come into an acute care environment to have that end-of-life care. There's one story where we did discharge a patient back into their home environment. They were a metastatic cancer patient, so they were end-of-life care. And I know that they utilized the Fraser Navigator to help with some of the ancillary services that are required, including bereavement support, which is huge for the family. After the patient passed, I actually had a loved one reach out to me and say, I didn't know that I could actually access some bereavement support services after my family member passed away. And so I thought that was, very powerful to be able to support that, because it wasn't a patient that would have necessarily been encountering our system, but it was a needed service for that family, and that support was definitely of value. And I think just speaks to the potential of how we can continue to add services to the navigator role of Fraser to help all sorts of encounters that our patients and our populations will face.
Yeah, it's very touching to hear the impacts, right? And Jennifer, what would be one word that you would use to describe our future of our health system, and why?
Convenient. With all of the technology that is at our fingertips and that we continue to evolve, it's going to bring a level of consumerism and concierge right to the doorstep of those that we serve. And so it's going to change that relationship, and timely access to convenient care is really important, and introducing convenience into the equation, I think, is pretty transformative.
And Amyeen, what is the one word that you would use to describe future of healthcare?
I think for me, it's disruption, and we're in kind of this phase of disruptiveness, and most people think that as a negative, and I'm actually looking at it as a positive. And I think that word disruption as a positive, because traditionally vendors in this marketplace of health IT, they've been traditional and looking at data a certain way. And now we have large vendors like Google and Apple and Microsoft coming to the table in healthcare and saying, hey, we can offer some support for this population, not necessarily just for the provider experience, but to drive better patient care, which is going to be huge. So I'm excited. It's definitely an exciting time to be a healthcare provider.
Well, Amyeen and Jennifer, thank you so much for walking us through what it looks like in digital transformation at Fraser Health. Our digital strategies are some of the biggest catalysts that we have to be able to transform the services that we provide, so that we can improve provider and patient experience and quality of care. So thank you so much for joining us today.
Thank you.
Thanks.
Join us next time as we continue to get to the heart of healthcare. Don't forget to rate and subscribe to this podcast. The Heart of It is produced by Fraser Health Communications and Public Affairs.